In court Thursday, Dr. Eugene Sherman, the forensic pathologist that performed autopsies on James and Tasha Milhorn and Lena Marie Rose, testified about each victim's gunshot wounds, beginning with Tasha Milhorn and then Rose, and followed by James Milhorn.
Your pathological diagnosis for Tasha Milhorn.
She had gunshot wounds, too, of the back, and then she had some incidental findings. It passed through the skin and soft tissues of the back. It passed into the left chest cavity and through the left lung. Passed out of the left chest cavity in the apex, which is the top of the chest cavity, and then it penetrated into the soft tissues of the clavicular region around the clavicle or collarbone. It was associated with blood extravasated or leaked out along the wound tract. There was blood in the left chest cavity. The soft tissues were pulpified along the tract. The left first through third ribs were fractured in the back posteriorly, and the left clavicle was fractured. So the trajectory was from her back to her front, from her right to left, and slightly upward. I did recover a projectile as well as some small fragments.
Okay. And if you would explain what you found, your findings were with gunshot wound.
Certainly. So gunshot wound B is in the same right scapular region, and it also passed through the skin and the soft tissues of the back. It passed through the 6th and 7th thoracic vertebrae, and that included, buried within the vertebra of the spine is your spinal cord, and it passed through the spinal cord at that level. It passed through the esophagus and the trachea, and the trachea is the air tube from the upper airway. It passes down to the lungs, and it passed through the aorta, which is the major artery, the largest artery in the body. And it also then passed into the right chest cavity through the right lung. It left the chest cavity by perforating the sternum, which is, of course, the breastplate. It then passed through the soft tissues and skin of the anterior chest wall at an area that we generally refer to as a sternal notch. That notch is just above the sternum, and it left the projectile left the body.
And then, okay, went outside from the back through the chest.
Correct.
Rose was.
She had 4 gunshot wounds and some incidental findings. Gunshot wound A is of the right hand, and this is gunshot wound A. It was on the little finger side of the palm. It passed through the palm and out the lateral side, or the little finger side of the hand. When we talk about a trajectory through the body, such as the other one I described, front to back, right to left, and say upward, we're talking about the standard anatomic position. When you get to limbs, especially like arms, that becomes much more difficult to understand. So it's easier just to describe the standard anatomic position, and that is the body in an upright position, facing forward with the palms forward. So in this case, because it went through the palm and out the back of the side of the hand, it was from her front to back.
So would it have been like this, except is it the right hand or left hand?
It was right hand.
It's the right hand. So her hand, it passed through the palm, it would come from here through.
Except it was way over on the little finger side.
Okay.
It was here.
Would it be, what I'm asking, would it be consistent with holding your hand out?
It could be consistent with that, yes, sir. Gunshot wound B The entrance is in the inner aspect of the upper right arm, and the exit is through the soft tissues and the skin of the right side of the neck. Wound here across the mid-face. In this particular case, it resulted in disruption of the mid-face with missing skin and missing tissue, missing bone fragments, open fractures of multiple facial bones. In addition, there were linear fractures of the skull, and as a result of those, there was blood that had collected in the subdural, subarachnoid, and ventricular spaces of the brain. The projectile was not recovered. There were some minute fragments that I was able to find along the track.
And you know the trajectory of these?
The trajectory in this case is based on the skin tags. The skin tags along a grazed wound will point towards the direction from which the bullet came. So the skin tags pointed to the right, so in this case, it went across her face from the right to the left. Yes, gunshot wound D is located in the left hand. It's right here. The projectile entered from the dorsum or back of the hand of the web space between the thumb and the index finger. That fleshy area that you have on your hand. It passed from the back to the palm. It disrupted the soft tissues along the pathway. There was no projectile recovered. There were some minute fragments that were recovered. And its trajectory then, because of the standard anatomic position, was from her back to the front.
Was he treated prior to coming to the Forensic Pathology Center at Johnson City Medical Center?
He was.
Unlike the other two, they arrived, they were brought from the scene, deceased to you. Mr. Milhorn was transported from the scene to Johnson City Medical Center where he passed away there, then was brought to you.
That's correct.
And you know what time he died?
He died on August the 29th at 7:38, I believe, p.m. One second. Let me double check that. Yes, sir. It was 7:38 p.m.
Okay. So he was brought to the Forensic Pathology Center, and then subsequently you did the autopsy.
Correct.
And I'm going to ask you some questions similar to the ones I've asked about two other individuals. Can you state within reasonable degree that it was certainly pathological diagnosis of James Milhorn?
Yes, sir. I can. He had two gunshot wounds of the back